that I referenced are provided to community services clients. Okay, so we're talking about low-income Nova Scotians over and above that income threshold.
Not insured.
Okay, not insured, people who do not have insurance. All right, so that's the group that we're talking about. All Nova Scotians, and now we haven't set the income threshold yet, but it would be those individuals who are not now being serviced by community services, who have low incomes and do not have an insurance policy that would assist in covering these items.
Thank you, Mr. Minister. That brings us to the moment of interruption. And there's the Speaker.
Recognize the honourable member for Sackville-Clubwood on the this evening's light debate.
Thank you, Mr. Speaker, and I appreciate this opportunity to speak on this very important issue, and that is pertaining to the condition of amateur sports in this province, Mr. Speaker. And I'd like to read the therefore be it resolved that this government show its support for youth sports in the province by covering the cost of uniforms of Nova Scotia athletes competing in this summer's National Track and Field Championships, Mr. Speaker. And I think it's a very serious issue that we need to pay some attention to. And I think the government needs to pay attention to this, Mr. Speaker, because amateur sport in Nova Scotia really needs a commitment from this government to start funding them adequately enough so that our youth, especially our youth, have the opportunity to participate in sports across this province and across the country, Mr. Speaker. It was brought to my attention, this pertaining to this resolution, Mr. Speaker, as a member of the Veterans Affairs Committee. I was sitting there and had the opportunity to witness the Legion member, Mr. Jack Hatchard, who's actually a member of the Legion in my area, Calais Branch 162. But he's also on the executive for the Executive Provincial Council for Nova Scotia Nunavut Command for the province. And ironically enough, with all the important issues and important ventures that the Legion are involved in, especially when it pertains to our veterans in the province, one of the issues and one of the things that they deal with, Mr. Speaker, and try to support is initiatives that pertain to youth and youth sport. And this resolution came about because here was Mr. Jack Hatchard, who was heavily involved with a lot of the opportunities, or heavily involved in promoting youth sports, especially the Legion Track and Field program that we see in the province, where he was coming to our committee to actually ask and almost beg us to give him some advice on where he could go to get funding for the young athletes that are going to represent this province this summer, later this summer out west, Mr. Speaker. And I was appalled to hear him sit in front of the Committee of Veterans Affairs asking us for assistance on trying to get funding for our young athletes. There was, I believe, 38 athletes that are going to represent this province later this summer, and their coaches and some of their chaperones, Mr. Speaker. And these athletes are being asked to pay for the uniforms. Something that I can't believe. It's shameful to think that these athletes that train and work hard throughout the year just to make these track and field meets throughout the province and throughout the country, Mr. Speaker, have to spend their own money to cover the cost of the uniforms. This is a uniform that's going to have the Legion logo on it, and the Legion spends a lot of money promoting and supporting this track and field initiative and program. But they're also going to have the Nova Scotia name on it, Mr. Speaker. The letters NS will be usually across the back of their jerseys when they're out west representing our province. These young athletes are going to be great ambassadors for our province, yet the government is not supporting these people. And that's all we're asking, Mr. Speaker, is that government needs to step in and support our young athletes, especially the ones that are exceeding in the sport that they choose to be involved in, especially with the track and field athletes, and they're going to be representing our province. When they go out west this summer, they're going to be asked, where are you from? And they're going to say, I'm from the province of Nova Scotia. And it's really sad to say that these athletes are going out there having to fund themselves to wear just the uniform that represents our province, Mr. Speaker. So I'm really disappointed that this piece of this motion was denied several days ago. The good member from Timberley Prospect brought this forward, and I couldn't believe when government members named this motion. And Mr. Speaker, I was standing in sitting in my seat, and I seen the Minister of Health Promotion nay this motion, Mr. Speaker. Shameful. And I cannot believe it that the Minister in charge of health promotion in this province, and after the day I was elected, this government promoting the new Department of Health Promotion, promoting that they want to initiate programs throughout this province that would hopefully change the lifestyle of Nova Scotians, especially our youth, because I think that his department is trying to target a problem we see in society and in Nova Scotia, Mr. Speaker, and that's the inactivity of our youth. Here's a chance for some of our youth to participate in a sport. They're being active. They're actually, I think, in the long run, going to save this province money, especially healthcare money down the road, because they've chosen to be active. They've chosen to be involved in sport and recreation in this province, and here they are, have a chance to represent our province. And they can't even go to these games and have the uniforms provided for them, Mr. Speaker. And I can't believe the Minister of Health Promotion actually sat in his chair and made this motion, Mr. Speaker. It's unbelievable. I had the opportunity years ago, about 15 years ago, Mr. Speaker, to attend the Canada Games out west. It was in Saskatoon, Saskatchewan. And I remember being a young athlete, being so proud to be able to represent my province in those Canada Games. And I remember being paraded around in the Red Room across the hall, Mr. Speaker, and I was very proud of that. But I didn't pay for my uniforms, Mr. Speaker. I didn't have to cough up money to just to have a uniform to go out west, Mr. Speaker. And I can't believe in a short period of time, 15 years, and actually this year is the year of the Canada Games, which ironically enough is going to be in Saskatoon, Mr. Speaker. I never had to pay for my uniform. And I can't believe 15 years later that our youth and some of the track and field athletes in this province are being asked and are required to pay for the uniforms to represent this province. I think it's appalling, and I think the Minister of Health Promotion especially needs to commit to these young athletes to pay for their uniforms. What would it cost, Mr. Speaker? Maybe $1,000, I think, for these 38, 40 athletes to represent this province. $1,000, Mr. Speaker. I can't believe that this has even come to my awareness in Veterans Affairs. I know that Jack Hadgert, who works hard to try to promote the initiatives of the Legion Track program here in the province, he would love one day to be able to host the National Legion Track and Field Championships here in the province. They would love to do that, but they don't have the funding, Mr. Speaker. And it brings me back to the point that I'm trying to make, is that amateur sport in this province, they need the help of this government. They need to have the opportunity to grow their programs, to hopefully get more youth involved in it, and when they have to spend most of their time fundraising and trying to raise money just to put uniforms on their back, that's where I can't believe it, Mr. Speaker, and I would hope that this government, with the initiatives that they've stated over the last 18 months or so since I've been elected, that they want to try to promote health promotion in this province, and that the minister announces money for this and money for that, all these small programs that these athletes don't even have uniforms to wear, and they got to supply their own uniforms. It is shameful, Mr. Speaker, and I hope the Minister of Health Promotion realizes the importance of adequate funding to our amateur sports in this province. It's not just track and field. I know that this resolution pertains to track and field, but it's every sport known that's being played in this province, Mr. Speaker, that is underfunded. It's unbelievable how much money is coming off of what Sport Nova Scotia and other athletic Nova Scotia has had in the past and what they have today. And I think it's time that this government, if they're serious about their initiatives on health promotion and promoting a healthy lifestyle for our youth and for all Nova Scotians, is that they get up and they pay for these young athletes' uniform. They're not there representing Sackville or representing Yarmouth, Mr. Speaker. They're representing the province of Nova Scotia, the people that we are here elected for and stand up in this legislation for, or this legislature for, to hopefully bring good public policy forward. But it's unbelievable to me to know that these young athletes can't even get uniforms paid for by this government at a mere maybe $1,000, $1,500, Mr. Speaker. The people that I represent in my area are frustrated when we hear of wasteful spending by this government, and I hope that the Minister of Health Promotions will realize the importance of funding, especially uniforms for our athletes.
Thank you. Recognize the member for Preston.
Thank you, Mr. Speaker. Youth are a priority for our caucus, and we are in full support of this resolution presented by the opposition party. It's time that the people of Nova Scotia are represented properly at these events, these track and field events, and the young people that work so hard and give up most of their lives to get to a standard where they can compete on a national basis. And I think it's only fitting that they should be provided with uniforms, and nice uniforms, to go to the national track and field championships this summer. Unfortunately, the government hasn't seen the wisdom in investing in youth as much as they should. I'm sure my honourable colleague from the government side will disagree with that, but unfortunately they haven't. We've seen many programs cut and changed and eliminated, programs that make a big difference. Here in the news all the time, there's swarmings in the community and youth out on the streets causing all kinds of problems. Probably if those children, when they were children, before they became youth, had the opportunity to be participating in organized sports and could afford to do those things, probably wouldn't be participating in these swarmings. They'd be doing other things that would be more productive and really help our community. You know, the whole basis of our economy is based on youth and what the youth can do and the new ideas they bring to things. As we get older and we retire, we have to have a strong youth in place with a good education and a good solid background. Sports build character, self-respect, and teamwork, all the things we need to contribute to our lifestyle and the financial well-being of our province and our country. You know, it seems simple, $1,000 or a little bit more, whatever the case may be, for uniforms. Sounds like not very much for athletes to go and properly represent our province. Don't forget, we're going to be there, and it's the image of our province we're leaving with these young people. And if they go there and they represent us, it helps our tourism, helps build role models from the young people from our community that go, and they can go to other competitions. I have an excellent athlete in my area, Steve Giles. That's an excellent role model for other young children who are coming and in the sport that he participated in. And now we have many more young men and women in that community that are really setting the national standard, and not only national standard, international standards for the competition and the dedication and work they do. And they've got to spend all their time doing fundraising for things such as uniforms. They're really taken away from the time that they have to practice and work on their training, the things that they really have to do to ensure that they can truly compete at these competitions. There's nothing any worse to see our young people go out and not be properly prepared for these competitions. And they are tough. They're national, they're tough, they're the best in the country, competing against each other. And if their families can't afford to do the things that they need to do to put a young athlete through this process, and it's a very expensive job. If it's track and field where you don't need a lot of equipment, it's still expensive. All the trips you have to take for the training and get coaches and probably tutors for the classroom work that they miss because they're going to training, and all the other things that the families have to do. And then all the time the families have to spend away from other activities that may make it better for them at home. But it's worth it. It's worth it for the family. So I think it's just a small price for the people of this province to pay to help many, many young people that will definitely bring an excellent representation to Nova Scotia. You know, there's a lot of disparity between youth in our communities. And a lot of youth don't have the opportunities that some other youth have. And this will be one opportunity to ensure that this is one thing they don't have to raise funds for or do things for, to make sure that they can go and compete and be professional, look professional, and act professional, which I know they will do. The other thing is sports keeps youth fit and healthy. We see our healthcare costs going through the roof, almost to a point we can't afford healthcare anymore, but we can't not afford it. That makes any sense. We've got to invest in healthcare. But if we have a healthier, more fit society, which we work towards all the time with smoking laws and all the other laws we put in place to try to get people to be more healthy and fit, if we set the youth in place and work with them and to ensure that they have the tools and the role models that they need to move forward with this and represent the province in a very positive way. It's also part of our culture. Sports have been a long part of our culture in this province. You go to the Nova Scotia Sports Hall of Fame here and see so many Nova Scotians that have done so well in this province and outside this province and set many standards. You see the young hockey players there from Cole Harbour that has done so well. And you see the years and years of training that he had to go through to get to the level of playing ability that he has. You know, it also helps the youth when they participate in sports, especially at this level, to set goals for themselves now, in the future, and for the things they'd like to see change in our province. And hopefully some of those youth will be in this room when they get older, so they can do the things that need to be done and change the laws and make it fair for Nova Scotians and make sure that our great-great-grandchildren are set in a situation where they have positive possibilities of living here, and our young people can stay in Nova Scotia rather than going out west or to Ontario or to the U.S. to work. So all this is all tied together when you put it all together. Now, it seems like a small thing, and it's a stretch for some people to say, well, you buy a uniform for a young child, or not a child, these aren't children, these are youth, and it helps them work and do things that we need so desperately done in this province. And I already mentioned one time already that cost to families. We get a family that has one member of the family in a sport of any kind. There's so many trips to the park and where they practice and making sure they get things done for them. Maybe they have to be on a special diet that costs extra. Maybe there's some training equipment they need. All things that typically aren't covered by any program that would be in place here. But the families have to pick that up. And that's very, very expensive. Maybe one of the parents have to pick the children up, or not the children, the youth up. When they go to a sports facility, they may not be able to work extra hours that week they need to provide funding for something else they want to do. And the whole family really makes a sacrifice when this goes in place. So it's a very small sacrifice for us as politicians to go and see this happen. It's you know, as you go through this process and you see, I can't imagine the government not spending money on something like this. You know, there's a lot of things that we criticize the government for spending money on, and justifiably so. Sometimes they spend money on things we don't give them credit for, and we should do. But we should definitely, this is something that to return so much back to Nova Scotians, and especially to the youth and the families of the youth that are privileged enough to be good enough in their sport to attend these functions. I don't know why we can't take and convince the government to spend $1,000. $1,000, as we've seen by some of the bonuses been paid to some of the deputy ministers and some of the other things that money's been spent on, that it's a very small amount. When you look at a $5 billion plus budget, $1,000 doesn't really represent even a small, tiny, tiny fraction of that. And the debt load this province is carrying, the millions of dollars that goes through every day, I believe it's $2.5 million every day, the debt service charges in this province. So $1,000 is nothing. And the benefit to the community and the benefit to the youth would be incredible. So we really have to look at the things that we do and ensure that this is one thing we never forget. Because if we lose our youth, we lose the heart and soul of our province. We see them moving away and we see them doing things that they shouldn't. But if we've got role models in young men and women that can set the example for so many more people to come, and the small children, when they see these people participate and do well nationally, it's important that we can support them in every way we can. Now, as the support comes in the training and all the years they've worked to get here, it makes it very, very difficult. So at least we can do, as people in this province, is provide them with a decent uniform that doesn't cost them or their family anything, and really support them as they go forward so they can represent this province with pride. Thank you.
Thank the honourable member for that. The honourable member for Waverley, Fall River, Beaverbank.
Mr. Speaker, thank you for allowing me the opportunity to stand before this House. I think in starting out, I'd like to recognize some of the athletes who actually sit in this House. The honourable member from Timberley Prospect being one, and perhaps another of equally talented individual would be the member from the beautiful Musquodoboit Valley. Somehow they got there on their own because they didn't have the benefit of governments supporting recreation the way that this government has supported recreation. And I would also like to take the opportunity to look at the members opposite and ask them, when Bill 172 comes to the floor of this legislature, if they're prepared to recognize the statements they've made today and recognize the fact that we have an opportunity for $15 million of infrastructure free of taxpayers' dollars to come to the Bedford Commons for ice rinks that my residents and the residents of this area need. So to stand across the floor today and tell me that they support recreation to the degree we need the support, I invite them to support this when this bill comes to the table. I would also like to recognize the achievements in my community that this government's been a part of. Our Chima Canoe Club recently sent 4 athletes to the World Championships, and where they fared very well. We not only sent athletes, Mr. Speaker, we sent coaches, and we sent parents along to accompany athletes for their support, as well as recently we announced $300,000 to support increased facility to accommodate the Chima Canoe Club, as well as international training facilities. This government, Mr. Speaker, made that possible. Also, Mr. Speaker, I would like you to know that just recently, as recent as yesterday, I had an announcement of $25,000 to support a project that is an HRM project that, in fact, I fought for as a councillor to get and didn't get it until just recently with the support of this government, with a donation of $25,000 to resurface the Ryan Rosen Field. But, Mr. Speaker, my reason for standing here today was not to boast about what goes on in my district and the money that this government's put into my district. Mr. Speaker, I would like to bring you a few words regarding the Office of Health Promotion and what the Minister has done for this area. Mr. Speaker, Nova Scotia Health Promotion is the business of promoting health. But health is more than just the absence of disease. It's a state of emotional, physical, and spiritual well-being. Sports can and will play a vital role in achieving that, Mr. Speaker. We're helping Nova Scotians be more active, especially children and youth, and it's a priority at the Office of Health Promotion. And, Mr. Speaker, we're providing tools to make regular physical activity a part of everyone's life. I'd like to tell you about some of the ways that we have supported young people in being more active. In August of this year, we're sending 450 members of Team Nova Scotia to the 2005 Canada Games in Regina, Mr. Speaker. They're provincial teams, and we're providing their team uniforms. Each year we provide block funding, a total of $840,000 to provincial sports organizations. We review their spending, but we do not dictate. They manage their own funds, Mr. Speaker. Some choose to spend the funds on uniforms, others choose to spend the money on things like officials and athletic development. We also provide annual funding to Nova Scotia, a total of $1 million a year for Sport Nova Scotia to offer sport programming, funding, advocacy, fundraising, and they provide support in many ways to all provincial sport organizations, Mr. Speaker. They're a very valuable partner to us, and we work closely with them to enhance sports in this province. In October 2002, Mr. Speaker, we will launch an Active Kids, Healthy Kids strategy, a provincial physical activity strategy for children, youth, and families, aimed at increasing the number of children and youth who accumulate their recommended 60 minutes of physical activity at 5 days a week. The strategy's 6 components range from grassroots community approaches to policy and program development. As part of the strategy, we provide funding to some schools and communities to create sport and physical recreation opportunities, Mr. Speaker. This year, we're repeating our research from 2001 that will tell us what progress has been made in the physical activity levels of youth. It will give us new information which will plan for the future programs and enhance our existing ones. Last year, we as a government launched a physical activity grant program. A total of $500,000 was awarded to organizations who created or expanded on opportunities to help Nova Scotians be more physically active. A lot more people got active this year thanks to those grants. People who might otherwise be inactive, Mr. Speaker, have had the opportunity to participate in activities that lead to lifelong physical activity. That's why we're continuing the grant program again this year. Mr. Speaker, we know the cost of barriers to kids participating in sports, and we have two initiatives to help reduce that barrier. New this year is a $1 million investment to help families with the cost of registering their kids in sport and physical recreation. Parents or guardians can claim up to $150 on their taxes. That means if you register your children for 3 sports programs throughout the year at $50, you can claim all 3 for a total of $150, Mr. Speaker. We're not reducing costs, but we are reducing cost barriers in sports in another way too, Mr. Speaker. Last year we provided $330,000 to Kids Sport, and we're providing funding again this year. Kids Sport is a program administered by Sport Nova Scotia that's helped children overcome financial barriers which prevent or limit their participation in organized sports. Parents can receive up to $200 per child to help the cost of organized, and our investment will triple Kids Sport's previous budget. I must commend Nova Scotia Sports for so successfully administering this program. Recently, they partnered with the Department of Community Services, Mr. Speaker, to ensure that people who need it will know about and will access the help that's there. Mr. Speaker, earlier today, the Health Promotion Minister attended Sports Fair at Dartmouth, Delplex rather. It's an annual event put on by Sport Nova Scotia and partially funded by Health Promotion. It's an alternative multi-sport event that encourages children and adults to be more physically active by exposing them to different sports in Nova Scotia. Mr. Speaker, the minister played basketball, fencing, and although he plays a little fiddle, he didn't do that today. And he witnessed the kids of all ages trying out every sport you can imagine, Mr. Speaker. Over the next 3 days, thousands of kids will visit Sports Fair and be immersed in that sport. Sport Nova Scotia's CEO, Jamie Ferguson, was also at Sports Fair and had a chance to commend on this issue of funding team uniforms. He said, and I quote, "Recognized provincial sports organizations are responsible for producing and spending their own budgets. Some organizations provide uniforms while others allocate their funding elsewhere. Jamie, too, felt that it should not fall to Nova Scotia Health Promotion to examine and approve their individual expenditures. The province simply cannot purchase uniforms for every individual team that asks. In any given year, up to 400 teams go to national competitions, and it's cost prohibitive. But I do wish the track and field team the best of luck at their competition. I congratulate them for making sport a part of their lives. And Mr. Speaker, in closing, I again reiterate, I look for the sport of those opposite for $15 million of sports funding for the children of Nova Scotia in the Waverley, Fall River, Bedford area. Thank you, Mr. Speaker.
No. Now, member of Dartmouth North.
Thank you, Mr. Speaker, and I want to say that it's I guess appropriate for the government member on the government side of the legislative floor to talk about the government's commitments to health promotion. Let me tell you that it was simply long overdue. And what the government has done is gradually meted this out in a piecemeal sort of fashion. Many Nova Scotians, as a result of the government not recognizing the importance of being actively involved in sport, at least a few years ago when the government started generating surpluses, that in fact it would have done a much greater job, and today many of those Nova Scotians would not have found themselves with obesity and a number of other diseases that are contributing as a result of that. With respect to sport-related facilities and so on, Mr. Speaker, you and I both know that in fact in Spring Hill here a few years ago that in fact there was a serious...
Order, please. Order, please. No cell phones in the chamber, please. No cell phones in the chamber on, thank you. Now, member for Dartmouth North has the floor.
Thank you, Mr. Speaker. And as I was reiterating with respect to Spring Hill and the Spring Hill hockey rink that was destroyed as a result, in the people in that community recognizing the importance of having that facility available. In fact, did a tremendous job and bringing forward the needs of making sure that there was funds available to restructure and rebuild the Spring Hill rink. And I'm sure today, many of those people are taking an active role, and I can assure you that that rink is used year-round. I would say that, Mr. Speaker, I would only be too pleased to have the Minister of Health Promotions and the Minister of Finance and the Minister of Health and everyone else come to the constituency of Dartmouth North and look and take a complete review and look at what are the particular needs with respect to many people in Dartmouth North who would be delighted to take advantage and have the use of facilities. We do have a facility called the Dartmouth Sportsplex, but it's off limit to many Nova Scotians and to many Dartmouthians, I should say, simply because many Dartmouthians, even though there are some registration fees, particularly in Dartmouth North, are unable to afford to participate.
Order, please.
In some of the sport
time allotted for this debate has expired. Thank the all members taking part in the debate this evening. House will now revert itself back into whole House on committee on the whole House on estimates.
Minister of Health on estimates. But
Madam Chair, the estimates of the
thank you. The Minister of Health on estimates, but he's not here at the moment, so we'll just wait for a few minutes till he shows up. He's not ready yet. The honourable member from Pictou West.
Thank you, Madam Chairman. And back to the Minister, I guess, on health estimates. And while your staff is waiting to come in, I want to, in the few minutes I have remaining, come around to the question of long-term care, and in particular in relation to a particular concern that a resident of mine has brought to my attention on several occasions. And this concerns the system and how it changed on January the 1st. Certainly we applaud the system and that no longer are people's assets being seized, and you know, and rather it's based on an income level. And certainly people under the old system, many of them paid hundreds of thousands of dollars until their assets were depleted and nothing was left. And I'm particularly concerned about these people that maybe have given all they've got to give. They've spent $250,000 or $300,000, sometimes even more than that, over several years until they've got nothing left to give. And this happened with a couple from the town of Pictou, and that their assets were depleted, and then because of the spousal income rule, they were assessed I think $1,071 that the husband had to pay for the wife's care in the nursing home. And after January 1st, it was sort of contemplated that would end. That would be the end of it. And in fact, Mr. Minister, I recall asking you here a year ago in health estimates if the spousal contribution required would discontinue, and you told me yes, it would. It would no longer be a factor. So I want to ask in particular on behalf of people that are under the old system that still have the $105 comfort allowance, why is it that they're still being asked in some cases to continue paying for their partner's care that's in a nursing home?
The Honourable Minister of Health.
Thank you very much, Mr. Chairman, Madam Chair, sorry. And the honourable member raises a question which is which has affected a few families that we've been made aware of with respect to their circumstances. The decision that was taken was that there indeed would be a recognition of household income relative to the financing of nursing home costs. And the threshold was established based on the splitting of the income. I've seen enough cases to date to cause me to believe that it is appropriate for us to do a review of this situation, which as I indicated when we rolled the program out, that we said we would, for the first year, monitor it very carefully and look at circumstances that need to be altered. And I can say that that is one of the circumstances that we're looking at. We have not come to any conclusions with respect to our position on it, but it is something that we are taking a very keen interest in, and will be analyzing it very carefully.
Thank you. The honourable member for Pictou West.
Thank you, Mr. Chairman, and I'll come back to this same issue. In your continuing care briefing document, there's a line that reads, "There is a recognition of special situations faced by residents whose assets have already been depleted." And that's exactly the case with this particular gentleman, in that they've given up a lifetime of savings. It's all gone. And now not only is it all gone, he has to pay an additional amount every month for his wife's care, $1,071. And it just seems unfair, because I'm sure there's not too many in the province that are in this situation. Most nursing home residents are singles, I would think, but there's a few that still have a spouse left in the community. But in addition, under the old system, they've paid all they've had, and now they're paying again over and above what she's being charged. So there's just an unfairness to the system. So I guess, Mr. Minister, I would ask that you might consider what's in the document, where there would be special situations. I think this is a special situation for review. And finally, I think it mentions in that same document that that changes can be considered. You know, it is, as you mentioned, a policy in flux, and you're reviewing your information as you go along. And I would hope that you can consider special circumstances and review policies that are unfair, so that it is fair to even those that have lost everything already. So maybe again, Mr. Minister, I just ask you to comment on this situation and ask if can there be some review of special circumstances, and especially for those that have already lost everything.
Thank you, member. The Honourable Minister Felt.
Thank you very much, Mr. Chairman. The honourable member would appreciate that I won't involve myself in discussions about specific cases on the floor of the House, but I would encourage the honourable member to write to me with the specifics of the situation he's referencing, and we will certainly take a good look at it.
Thank you, Minister. Member for about 2 minutes.
Okay. Switch gears here to another topic, and that's ambulance fees that residents in this province pay. I think the fee that is charged to residents between hospitals or between nursing home to hospital is approximately $120. But if people are involved in an accident, the fee that is charged is $600. And I have a case of a constituent in my riding where there's a vehicle accident, and one ambulance came out and took both 2 people to the hospital, and they were each charged $600. So there was a $1,200 ambulance fee bill for one accident. It just seems exorbitant. $1,200 for one ambulance to take victims to a hospital. So, Mr. Minister, if I could ask Mr. Minister about ambulance fees, and the $1,200 was charged to 2 people from 1 accident. It seems too much, and is it possible that our fees could be reviewed, that a more reasonable level could be exercised on people?
Thank you. The minister has approximately 1 minute for his answer.
Thank you very much, Mr. Chairman. The fee that is charged, Mr. Chairman, is well below the cost that it provides to provide this service. And you have to think of it in terms of the cost of providing the service, not in the ambulance trip, because you're not paying for a trip. You're paying for an overall service, and the number of calls that are answered in a given year divided by the total cost of providing the service gives us a per person charge relative to the provision of the service. And most, indeed, if people are appropriately insured in this province, all trips related to automobile accidents are items that are covered under the insurance policies that are in play in those circumstances, and so that's how it goes. So it is $816 is the cost of a single ambulance service per person. So it is not, you're not paying for the cost of sending the ambulance back and forth. It's all of the backup services that are related to the provision of that service.
Thank you, Minister. The time has expired. I'll recognize the honourable member for Glace Bay.
Hey, why don't you explain that to the House? Thank you, Mr. Chair. Not laughing at you, Mr. Minister. It was a private joke over here in the Liberal caucus. And it wasn't connected with the Department of Health in any way, shape, or form. I want you to know. Anyway, well, the clock is ticking, Mr. Minister, I can tell you that. I wanted to just finish off our time talking about the estimates of the Department of Health with a few questions, first of all, about long-term care. And I also wanted to enter onto the record concerning home care. I must admit that I couldn't agree more with my colleague from Richmond on the issues that he raised about home care. And it was an issue that came up time after time after time when we toured the province on our cross-province tour last year with the Liberal Roundtable on wait times. And it was continually identified as the number one issue that we were told about as an idea whose perhaps time has come and something that would indeed help the healthcare system. But just before I get onto that topic, Mr. Minister, if I could, Mr. Chair, through you, I understand from the business plan for the Department of Health that on page 27, to be exact, that the Department of Health will begin evaluating the impact of the new long-term care policies and their impact on residents and families. And I would like to know what complaints that the department has heard from seniors with respect to those changes, and what specific policies that you will be evaluating.
Thank you for that question. The Honourable Minister of Health.
Thank you very much, Mr. Chairman. I thank the member for the question. The most significant concern that has been expressed to us centers around the income splitting of families and some of the hardships that has created in some circumstances. And we're certainly looking at that very carefully with a view of addressing it. There were some other issues that came about through the Nova Scotia Association of Health Organizations, and they have identified some concerns related to the challenges that face the long-term care facilities relative to the new policies, and we're committed to working those out. There was also a concern centered around the recreation services, and we addressed that particular concern as well.
Thank you, Minister. The member for Glace Bay.
Thank you, Mr. Chair. The personal use allowance that was once known as the comfort allowance, that now co-pays for prescriptions and ambulance trips and eyeglasses and dental work, now all the responsibility of the resident. Have there been any number of complaints concerning that? And I also wanted to know, do you not consider those, Mr. Minister, do you consider those health costs?
Thank you, member. The Honourable Minister of Health.
Not in the nursing home. Yeah. Thank you very much, Mr. Chairman. And the costs that are referenced by the honourable member are costs that that all Nova Scotian citizens have to pay, and whether you're in a long-term care facility or whether you're in your own home, those are charges that apply to you. And the policy with respect to the personal use allowance for these individuals is consistent with what is charged to individuals outside. You know, the other aspect related to this is that all of the assets that individuals had prior to coming to the long-term care facility now remain with those individuals. So the circumstances are quite different for new people coming to the facilities than they were for those who were covered under the old policy, where assets were depleted in order for payment to be made for the service of health care. So the individuals currently in the long-term care facility are treated no differently than individuals who are remaining in their own homes.
Thank you, Minister. The member for Glace Bay.
Mr. Chair, could the minister indicate why there is currently no appeal process for decisions that are made with respect to the amount of income that's left for the resident who remains in the community? And once I hear that explanation, well, let me give you what I'm wondering, what I'm thinking before you give me that explanation. If it's not the amount of income, for instance, that's required to live in Halifax Regional Municipality is greater than what's required to live in other parts of the province, I would expect. So why indicate to us why there is no appeal process for those decisions that have to be made, please?
Thank you. The Honourable Minister of Health on the question.
Thank you very much, Mr. Chairman. There is, with respect to all decisions taken by the department, the capacity to be able to appeal. As I made reference earlier in some comments to the honourable member for Dartmouth South, I believe, we are looking at our entire appeals process within the Department of Health to try and come forward with a process that is separated from the departments in its day-to-day operations, so that there can be a greater acceptance of the impartiality of the appeal process. And that is something that we are considering. We have, in fact, responded to inquiries from individuals and families as the program has rolled out, and we have looked at each situation separately, and we have addressed particular situations. The experience is telling us that indeed it's appropriate for us to look at the whole issue of family incomes and how they are assessed relative to the charge that is made to the household with respect to one member of the household being in a long-term care facility. So that is a process that is under review currently.
Thank you, Minister. Member for Glace Bay.
Mr. Chair, could the Minister please tell us when he expects that review to be completed and if the findings of that review will be made public?
Thank you. The Minister of Health.
Thank you very much, Mr. Chairman. I anticipate in the reasonably near future bringing forward recommendations to Cabinet with respect to appropriate changes that would be required in order to address the shortcomings that are apparent.
Thank you, Minister. The member for Glace Bay.
Thank you, Mr. Chair. As I mentioned, I wanted to touch on the topic of home care and the comments that were so eloquently made by my colleague from Richmond County regarding home care, what it could mean to this province. Again, on page 27 of the business plan, it is mentioned that direct funding as an alternative way to deliver home care services is mentioned. And I'd like to ask the Minister, could he indicate whether the direct funding program policies currently being finalized in the department will include a return to the in-home support program that the government froze 5 years ago?
Thank you, Member. The Honourable Minister of Health.
Yeah. Thank you very much, Mr. Chairman. The self-directed home care program is a program that we are proceeding with. The in-home support, excuse me, the in-home support program is a program that we are currently reviewing with the Department of Community Services. The Honourable Member would know the history of that program is one it was with the Department of Community Services, came to health, the freeze was placed on it. There is money in this year's budget within Community Services to provide in-home support for an element of the population. We are reviewing the other spectrum of the population to see what programs are appropriate and to decide whether it's appropriate for those programs to be delivered by Community Services or delivered by the Department of Health, and that process is underway.
Thank you, Minister. The member for Glace Bay.
Mr. Chair, it's strange how things seem to come to you at an appropriate time, but I wanted to take this opportunity with the time that's left to enter a letter into the record during these estimates, and it talks about home care. It's a letter that I just received on May 1st from Elva Vasallo, and I talked with Elva today, and I asked her permission, and she was absolutely thrilled that this was going to be read in the legislature because she wanted to make sure that her message was getting out there. And I know the minister and his staff will give me their undivided attention, perhaps just for a couple of minutes if I read this letter. Mrs. Vasallo lives on 168 Crestdale Drive in Sydney Forks. And she writes, Dear Dave, it's too late to help us, but since you're doing so good as health critic, well, I didn't want to read that part, but anyway, that's what Mrs. Vasallo wrote. Maybe my story could help someone else. She says, my husband Frank had been sick for over 30 years, and we managed and I could work to support our family. About 2 years ago, he really started to go down fast, and this past summer, his doctor suggested I go away for a rest. Our daughter came from Middle Sackville to look after her father while I was gone. I called home care, and I'll leave out the names of the home care workers, but she said I called home care, and they came out to evaluate Frank. I asked for help on Wednesday and Saturday or 2 other days, whichever was best for them. She asked to be left alone with Frank, and she decided he needed home care every day, which was fine. I went away on September 13th, 2004, and returned on September 29th. The morning of October 4th, 2004, Frank became very sick and had to be taken to the hospital by ambulance. He had congestive heart failure and pneumonia. He was in hospital until Christmas Eve. We had a hospital bed and all the necessary equipment to make him comfortable. I was able to look after him alone, and sometimes our daughter would come from Middle Sackville to help. Home care came every morning. Then they started coming at night for what they call a tuck-in. There was no need of this, so we stopped the tuck-in care. Then they started coming in the afternoon to get him up to walk, and he wasn't happy with this, so we stopped them coming. I had respite for 2 hours on Sunday morning so I could go to church, and 4 hours each on Tuesday and Friday. All of this was great. Now the problem came for me the latter part of February. Frank got what they call sundowners, where he became strong in the evenings and could sit up in the hospital bed and throw his leg at a bed, and I was afraid he would fall out and kill himself. I called home care to see if I could get some help from midnight until 8 in the morning. This way I could get some sleep and could carry on until midnight again. We had to put Frank back in hospital on March 8th, and home care came to see me on March 9th and told me, no, this could not be done. I asked if they could start to prepare Frank for the day at 6:30 in the morning, and again, the answer was no. I asked if they came at midnight, they could combine the two. Then I wouldn't need home care through the day, and I was told no. When they came to see me on March 9th, they had papers to be filled out to put Frank in a respite home somewhere in the province. We didn't make enough money to pay home care or to have someone come in on our own. They would keep him in a respite home for 30 days, and then he would go to a permanent home. This is not what I wanted. I needed help for 6 or 8 hours a night, and they would not help. What would the difference in the cost be? Besides, she says, Frank would have been so much more content to be home where we wanted him and where he wanted to be. And Mrs. Vasallo goes on to write, to me, this is so foolish, and I only needed help at night so I could carry on through the day. As it turned out, I went to the hospital that afternoon to see Frank, and I got a prescription from the doctor for him to sleep at night. I left the hospital at 3:15 p.m. and asked for 1.5 hours to get the prescription and get home. At 4:40 p.m., the nurse called and gave me a list of Frank's medicine to give him at supper time. They gave him his same medicine, only less in the morning and more at supper time, and she was sorry they hadn't given him his supper. I said that was fine. He arrived home at 5:55, coughing terribly. I put the mist machine on him and rubbed his chest and back, but to no avail. I called the hospital and they told me to take him back. I called the ambulance and he was on his way back to the hospital at 6:15 p.m. Shortly after arriving back at the hospital, the doctor told me he didn't expect him to live through the night. He passed away on March 15th. He had congestive heart failure again. Mrs. Vasallo says, you feel so terrible asking yourself, was there something else you could have done? I am sorry this is so long, but I felt I should fill you in on the whole story. I hope there is something that can be done to help someone else in the position that I was in. As I mentioned before, they would not pay 8 hours a day, but would pay 24. It doesn't make sense to me. Signed by Elva Vasallo. And I want to table that letter, Mr. Chair, for the minister and everyone to see. And I think it brought home very poignantly some points concerning home care in this province, Mr. Minister. I know it's a struggle. I understand that health care is perhaps the most difficult thing that we deal with in this province. That health care is certainly the most expensive thing that we deal with in this province. Healthcare professionals are telling us that they are frustrated, that they are worn out. Doctors are telling us the same issues about ER closures. We heard today of ER closures in New Waterford. I face them on a regular basis in my constituency of Glace Bay. You don't know when the ER is going to be open or closed. Now we face them throughout the province in some instances. They're becoming more and more of a problem. Private clinics, doctor shortages, ER closures. I understand, Mr. Minister, for you and your staff that this would be a struggle every day just to get up and deal with these enormous problems that are facing us. But we have to find a way to try and make things change. We can't continually pour money into health care, with expenditures now totaling almost $1 billion more than they were in 1999. And is health care any better in this province? If you asked, Mr. Minister, an individual such as Mrs. Basallo, or if you asked an individual who's waiting for orthopedic surgery, their answer certainly would be no. Mr. Minister, those who live in communities without access to family physicians, which is the first point of contact in our healthcare system, the entry point that prevents people from having to access the other levels of health care, they don't think that we, and I mean we as legislators, are doing a very good job of managing health care. A gentleman called me up the other day, and he told me that he wanted to get in to see his family doctor. His family doctor's receptionist told him that he would be able to get in to see his family doctor towards the end of June. The man is suffering in excruciating pain from a broken back, basically. Mr. Minister, the pressure points, the wait times, the ER closures, the frustration with doctor shortages, and so on, if you have no direction or no plan, and I'm including in that a plan that I think would be the first step towards perhaps solving some of the money problems, some of the big problems that we have in healthcare in this province, and that would be home care. If you don't have a plan or direction for long-term care, then we're just going to continue to pour money after money, more money into acute care, but we have not improved the system. And the most telling signal that our acute care system is blocked and not functioning, in my opinion, is what's turning into be right now the proliferation of private clinics and private centers and diagnostic centers and private hospitals. And those initiatives, Mr. Minister, I would suggest to you respectively that they are born out of frustration. Frustration that specialists are not able to help their patients and help them in a timely manner. Mr. Minister, I don't think that it's acceptable in this day and age that we had to pump another $70 million plus into acute care, not even knowing whether or not there is a plan. And in this budget, which is why we're talking about health care estimates for the last number of days, we see a smattering here and there and a smattering in the pressure point areas. We see a bucket load of money into acute care, but at the same time we see absolutely nothing for catastrophic drugs. For instance, we've mentioned during estimates the issue of Fabry disease, cancer patients. All of these amount to what I think, Mr. Minister, are missed opportunities in our province. Missed opportunities. From a healthcare perspective, we will pay for it in the long term. We'll pay for it down the road. It's a missed opportunity. The budget is a missed opportunity. In 1999, this government, under the direction of the Premier, said that health care did not need any more money. Now, at the same time, he stated that health care professionals told him that $1.5 billion was more than enough for health care. But we needed is a plan. It's what we have yet to receive, a plan. You just don't need the money. The money continues to pour in. The money continues to pour in, Mr. Minister. So we need a plan. And those expenditures that continue to mount up, they're not going to go anywhere, Mr. Minister. They won't go anywhere at all. We've talked about some possibilities, and I know that the minister and I know that his staff in particular, I know from the various sessions at Public Accounts Committee, your deputy minister has been there, I think, more than I've attended public accounts committees. And she's faced the music time after time after time of MLAs looking across the floor at her and saying, "Deputy, what are you going to do about this?" There's only so much that any deputy minister, that any minister, that any member, that any staff can do about problems that have become chronic and that problems that are now running rampant and out of control. But we have to. We have a duty, we have a responsibility as elected members to question ministers, to question estimates, and to try, I would think at the same time, to come up with some ideas, or at least to put forward some ideas that maybe they should be considered that they would be a help. As opposition members, it's not just our responsibility or our job to criticize for the sake of criticism. One can easily fall into that trap of criticizing. It's the easiest thing to do. But to criticize, I think, with a purpose, and my purpose here at this moment and over the past several hours that we've been debating the estimates is to try and get to the bottom of what is becoming a bottomless pit, and that's health care. We all know we can't continue to go on the way we are. A 9.23% increase this year, and we don't know what it's going to be next year. It was 11% the year before. We know that we can't continue down that road. We understand that. So when we suggest something that I think makes sense, and it deserves the consideration, I think, of an entire department, of an entire cabinet and executive committee, when we talk about home care, this is a theme, as I said, from time after time after time, that has been put forward as possibly one of the missing pieces of the jigsaw puzzle. In-home support as well. The minister himself referenced an excellent program which I had the opportunity to be explained to me in his home constituency of Antigonish, and the hospital program that's run by St. Martha's. It's going to slip my memory right, Hospital in the Home program. It's a tremendous program, one that I think deserves the attention of perhaps being tried on a province-wide basis. I don't know if that's possible or not. All I know is that when I think I hear a good idea, I think it's something that you should take a look at it. I understand that the minister and his department are taking a look at it. It makes me very happy to hear that sort of forward thinking, Mr. Minister, that if we look down the road, and we're all in it together, this is an aging population in our province, an aging population that I don't, as others think, is going to lead to more problems, but I hope that it would also lead to more solutions. But the end run, the end of the line is going to be that we will be there someday. Hopefully, not all of us, but unfortunately, a great deal of us are going to require some form of medical care down the road in this province. We know how good it can be, and we know we have the capability of making it better. And I think what we should be looking at right now are taking those possibilities, taking those ideas that are suggested to us, whether they come from the official opposition of the NDP or whether they come from the Liberal caucus opposition. I don't think it really matters. I think we've gone by the stage where partisan politics should be playing a role any longer in health care in Nova Scotia. I think we've finally reached the point where a three-party system, a minority government, whatever it takes to make the changes to health care. And if that means we have to be vigilant on issues such as private clinics or private hospitals, and I do personally consider them somewhat of a slippery slope on the way down to eventually leading to a healthcare system that you'd have one healthcare system for people with money and another healthcare system for people without money. And I don't personally think that that's the way we want to go. But at the same time, having said that, Mr. Minister, I agree with your comments that there is some room for private clinics to help publicly funded health care. And if that's the case, then fine. But we have to make sure that that happens. And having said all of that, Mr. Minister, I wanted to again thank your staff. I know that it's extremely difficult to sit over there and to listen to us ramble on sometimes and not being able to speak except into the ear of the minister. But we know, well, I didn't mean rambling in a negative way. I meant that in a very positive. It's very positive ramblings with very positive and constructive suggestions, I should add. And I wanted to thank you, Mr. Minister, and your staff for allowing us this time. It's as you know, it's the issue in our province right now. It is the biggest one that faces people, no matter what anybody else in the back row over there says. They're shaking their heads. It takes the most money to run health care. It's the biggest budget. It continues to gobble up money. And if we're not careful, I've said it once, I've said it 1,000 times, What's going to be left after the Department of Health budget is the Department of everything else. And we don't want to go there. We don't want to go there. So not on a nonpartisan ground that I stand at this moment, Mr. Minister, I encourage you and your staff to leave no stone unturned to find ways to make health care work in this province. Mr. Chair, I thank you very much for your time.
You got a minute to go. Kick the cat for a minute, Angus.
I'll recognize the Honourable Minister of Health.
Thank you very much, Mr. Chairman. I want to thank all members of the committee for their contribution to the discussion surrounding estimates. I understand, Mr. Chairman, that reached the stage where it's appropriate for me to call my resolutions. Is that how the procedure works? And so I would call resolution E9. Resolved that a sum not exceeding $2,559,740,000 be granted to the Lieutenant Governor to defray expenses in respect of the Department of Health pursuant to the estimate.
Shall the resolution stand? Resolution has stood.
Also, I want to call resolution E29. Resolved that a sum not exceeding $979,000 be granted to the Lieutenant Governor to defray expenses in respect of the Senior Citizen Secretariat pursuant to the estimate.
Thank you, Minister. Shall the resolution stand? It stands. I'll recognize the Honourable Government House Leader.
I move that your committee to now rise and report considerable progress.
Yes.
Chairman of the Committee of the Whole House and Supply reports.
That the committee has met and has made considerable progress and begs leave to sit again.
Agreed? Agreed. The Honourable Government House Leader.
Speaker, would you please call the order of business, public bills for second reading?
Public bills for second reading.
Speaker, would you please call the Financial Measures Act, Bill number 877?
Bill number 177, the Honourable Member for Cape Breton Centre has the floor. You have approximately 35 minutes.
5 minutes, wow. Mr. Speaker, thank you. Mr. Speaker, I don't think I'll be taking my whole 35 minutes tonight, but, well, we don't. Back to the good old days. My good friend from Richmond is here to encourage me, and you know, with that type of encouragement, Mr. Speaker, we just may reach the stars tonight. We may reach the stars tonight. But, Mr. Speaker, in the infamous words of where was I the other day? Yeah. But you know, Mr. Speaker, and I was getting glaring looks to my good friend, the Minister of Transportation and Public Works, when I was ready to take my seat, and I was talking about roads, and I said, you know, that's a subject that we'll be coming back to, hopefully, when I get to stand up again in this House, because as we know, I was up on Tuesday, and then yesterday was Opposition Day, so here we are again debating Bill 177. And what we want to talk about is, again, I will not talk about what's in the bill because I can't, but I guess one of the things that I really miss in the bill is where we're going with road repaving, reconstruction, and so on. You know, Mr. Speaker, there's not a member, I don't think, in this House, with save and except those that live in municipalities that do not have county districts or rural districts in them. I'm sure there's some here from there's one from CBRM, a member from Glace Bay. Matter of fact, the member from Glace Bay does have a TPW because he has a bridge that's owned by TPW at the bottom of Commercial Street. But many of the members in this House from HRM do not have those same concerns. But many of us, other members, do. And, you know, Mr. Speaker, there is a road that has caused me great deal of concern since I've been elected. And it's, as a matter of fact, I live on it. It's the Lingan Road. And it's, one could say it's about personal survival, but what it is, what was interesting was this road, when I was first elected in 1998, the residents of the area had called together a public meeting, and I was much more naive than I am today, Mr. Speaker. But I met with the residents, and they were saying, look, that the road is being done from the City of Sydney limits to the Devco railway tracks. And just so happened that it was a Liberal government, and it stopped at the end of the riding that a Liberal member was in. And when I went looking to get some more of this road done, which and I'll explain to what an important piece of road infrastructure that is, I was told by members of the Liberal clique that as long as there's a member of the New Democratic Party sitting in this House, that wouldn't be finished. So, you know, I felt, you know, okay, that's politics. I'm in here less than 6 months. Okay, you learn the hard way. That's the school of hard knocks. That it's not, you know, if you're not on the side of government, you don't get pavement. Now, this was fine, and I sort of took my lumps with it, but walked away and said, you know, that's wrong. That's wrong for a lot of reasons, but not the least of which, many people in my community, besides living on it, many other people use that as an access road to get to work in Sydney. And it's so important, Mr. Speaker. And you know, what happened was that road is now deteriorated after 6 years to the point, and you know, the minister realizes, I've sent him many correspondence on it, and this minister has acknowledged it, and you know, I wish I knew where that infamous list was, but nonetheless, him and I have corresponded on it, and at least I can say this much, I got a good and fair hearing. I would have liked to have got the infamous letter that here's the contractor, but nonetheless, we're working through that, and hopefully it will change. But that's, the problem is, Mr. Speaker, I wanted to highlight that because this is not about who represents the riding. It should never be that. We are all Nova Scotians, and we pay our taxes, and they should have the right to get back and forth to work in the easiest way of conveyance as possible when you're traveling our roads. And it should be in a safe manner. And that's what it's about. It's not about a bucket of asphalt. It's about safety. And it's about being able to provide for your family. So, you know, I would have liked to have seen a more finite reasoning and a finite probably list of what is really going to be paved in this province. But you know what? I'll continue to pursue this minister, and I'm sure he will continue to write me back, and hopefully it won't be too far down that road, that bumpy, rotten road, that the minister says, you know, you're right, that it's what it's about, and I take it. The delays are over money. I know that. It's not about a personal grudge against me or against the people who elect me. It's about trying to get the appropriate funds. And I hope that this is the budget that proves it. But I don't see it here in Bill 177, Mr. Speaker, so I worry about that. I worry about the safety. I worry for what I guess a real personal reason is that's the way my wife gets back and forth to work every day. That's the way my daughter, when she goes to university, goes down that road to pick up friends and vice versa, to get her to university. I understand those. And so they're you know, right gut level concerns. So I don't need a petition of residents, per se, to tell me what's wrong with that road and why it should be fixed. I know from personal experience why it should be fixed. It's right in my house. I know why it should be fixed. But it's just not for that sole reason alone. The reason is the broader community. The broader community, the member from Glace Bay, residents from his area go through there. It's areas that people from Cape Breton Nova go through there. So it's a valuable piece of infrastructure. And I go back to something earlier today about that road, is that, you know, I asked the Premier today about equalization and the report done for UNSM. And part of that deteriorating infrastructure is Nova Scotia Power. Nova Scotia Power continuously drives over that road with tandem trucks bringing raw fuel into the largest generating station in this province. And it's them, Mr. Speaker, that are beating the you-know-what out of that road, Mr. Speaker. That's a large part of the problem. The problem from the intersection of the 128 right up to the generating station, approximately about 4 or 5 kilometers, is in wicked bad shape because of that traffic, Mr. Speaker. All right and good. If the NSPI were to do the right thing, they have a fantastic rail spur that could take most of that in there, and that there's no reason for most of those trucks to be traveling on that road. But they choose not to. They choose to take a cheaper route, one would expect, and then they're beating the roads up, Mr. Speaker. And that causes a problem. So what happens? We have two real problems. We have one where there's a real $7 million deficit in property taxes owed to the municipality of Cape Breton, you would say, by the lack of a real municipal tax arrangement with Nova Scotia Power. So we don't see anything in the budget or Bill 177 about that taxing arrangement, and that's where you would assume that this would show up, but it's not. So what happens now is here's a large company that should be paying its fair share of taxes, that the onus would not be on TPW to do that work as fast as it would, but it is called upon to do much more work than it should because of the amount of heavy traffic by these large tandem trucks beating the roads up, Mr. Speaker. And while I'm on the issue of roads, I've got to say that the engineer, Barb Bailey, and the foreman, Walter Crane, are excellent people to deal with. Minister, I've got to put that on the record, that they're responsive. You call these folks, they get back to you, and you know, people aren't always happy with the answer, and that's fine. But the fact is that, you know, Minister, that you should be proud if you have people like that working for you. And the dispatchers during the winter, when you call. Well, no, see, now there's a member that's not quite as happy with the workers. Now, I got to tell you, the dispatchers, the snowplow things, I get local councillors who want to take the photo op when we do get a road paved, when we get a J-class road paved. They're the first ones out by the spreader getting their picture taken, but they're the first one to tell their people to call me because the snowplow isn't there on time. But I'll tell you, when we call the dispatchers, they'll tell you where the equipment is and when we can expect to get it there. And you know, they're only human and they have to work within a system. So, Minister, if anything you can take out of this debate tonight, go back and say, you know, like, I mean, I'm sure they're not all great, fantastic, through the roof, great workers, but I'll tell you, the ones I have to deal with on an ongoing basis, I would always like to say, they'd call me back and say, yes, sir, we're going to pave this road, we're going to fix this culvert, but some things, but I'm entering in a somewhat one-sided debate here. I did get some, but it showed up in the councillors' campaign literatures. They got it done, but you know, no, and I thank you for that. I mean, there was the second part of May Street was done through RIM. There was Holland and Belgium Street and Centre Street in Reserve done through RIM projects, and there was one other street over in Gardner Mines. But these are the ones I tell you, Minister, that all of a sudden, when it comes to winter to get them plowed, they're minding your problems, but when they get paved, the same people are hanging off the back of the spreader machine telling everybody how they got it done. So you tell me how they do it, I don't know. But nonetheless, that's the way it goes. I mean, you've got to be more vigilant, and that's why more money in Bill 177 would have been great, Mr. Speaker. I'm sure, that I appreciate what was done, and I'm sure there's not a member out here that wouldn't like to see more done in their rural communities. And hopefully, I've ingratiated myself enough with the minister tonight that something good may come out of tonight's conversation in a very public way. But, Mr. Speaker, let's get off of roads for a while. Let's go to the road less traveled. I think that was a famous line put forward by a former finance minister when he talked about his budget and he'd taken the road less traveled. Well, Mr. Speaker, and I laughed that day and I said, I know why you'd want to take the road less traveled in this province. But nonetheless, the fact is about what's in Bill 177, Mr. Speaker. What's in Bill 177? Well, Mr. Speaker, it is touted as an education bill. Well, that's, and it's a budget that's supposed to help everybody. But, where is it at on post-secondary? It's of no way, shape, or form. Mr. Speaker, I don't know. I think you had a chance to be in Cape Breton a few weeks ago, I hear, Mr. Speaker, and I heard you stayed on Olive Street. Now, Mr. Speaker, one of the finest men and families in the Waterford area, you stayed with Mr. Jack Tye. Now, Mr. Jack Tye's father, whose also his name was Jack, was a councillor for years in the old county of Cape Breton. And that's when they looked after schools directly. The county would have their own schools and municipalities. And and Jack himself was a councillor in the town of New Waterford. But these were folks that always struggled with finding funding for local schools and so on. And then it's kind of grown over the years of the roles and the size of school boards and how they're set up. They're gone from basically trustees to elected officials and so on. And that's one level. But the level that I want to talk to tonight, Mr. Speaker, is about post-secondary, because I think of our fine university in Cape Breton University, Mr. Speaker, because I talked about this earlier in my speech, and I've talked to the minister somewhat during estimates about designation. I don't know what the catchphrase is this year, and I asked him that, is it designation or de-designation they call it now? I'm not sure. But, Mr. Speaker, what this is, it's a system where if you have people taking courses and so on, and if the default payment or the default rate on the repayment of their loans, they will look at possibly doing something, taking the designation off the institution away, so it will not be eligible for student loan, which would be devastating. It would be truly devastating, Mr. Speaker, because when you live in areas of high unemployment, these are things that it's not always easy. It doesn't say the courses aren't good and the facility are not good, but if people have a hard time accessing unemployment or employment in their area, then what would happen is the pressure would be to close a facility, whether it's a public or a private college. And the other thing I talked to the minister about in estimates was just that, is that however you contemplate this, it sends a ripple to the education community, because when I sit down and talk to the student union at Cape Breton University, that's their fear. Their fear is because of such high chronic unemployment rates, is that we're going to have a problem getting these bills paid, and will CBU become one of these designated institutions. And I've got somewhat I feel a bit better somewhat after talking to the minister, because his idea, I think, is a bit more focused now on like what you would see, and it's not necessarily, and I'm not putting words in his mouth, but the fact that it's contemplated more on smaller institutions that are giving more specialized training that may not be relevant to the area. While it may be good training, there's just not the training that you could gain get gainful employment in the area. So I would like, to see something on the record about that makes sure that it would be good to see in Bill 177 that if there's to be support on for designation, or for we're not going to do it, or define it, and as opposed to putting it out there. So that's what I would have liked to have seen, Mr. Speaker. Healthcare, and we always know in budgets that where the healthcare line is going to be. It's going to be the highest line item in budgets. And yet, the fact of the matter is that, there are people that when you talk about healthcare, that they're saying, my needs aren't being met here. And that's a fair comment on their part. And I also understand the fair comment about the burden it places on government, because you can't be all things to all people. But, we're talking about expanded use or expanding long-term care facilities and expanding beds and so on, and getting more beds. And yet, we don't know where they're at. And now, again, I appreciate that Bill 177 can say that, but I would think in your budget document, I think you could start massaging where these are going to go. That it's not done, as I talked earlier, that it's not like roads, that it's done from a political purview, that it's done by a needs assessment. Now, I know, our DHA was one of the first DHAs to have basic single entry. Now, single entry, while people would complain about it, I think when it was let run its course, is a valuable tool to figure out where the needs were. Now, we've done it. We're there. We know where the needs are, and now we need them to be answered by government. I know that the Maple Hill Manor would like 20 extra beds, Mr. Speaker, and the need is there. The need is shown. The need is transparent, and it would be nice if government would say that's where some of those beds are going to go. I mean, that's in the heart of my community. It's an aging population, and it's there. Right now, we have residents from my community being put in or being asked to go to be sent to areas like Richmond, which that's a real. You may as well put them in Toronto for some people, Mr. Speaker, because these are people of very modest means. And if you're going to ask, there's just no way they can't get to Sydney, let alone get another 60 miles down the road to St. Peter's. So what you're doing is you're separating families, and that's why I would think that if we would do that, it's another community. It's a community-based option home, Dominion long-term care home, Mr. Speaker. It's a community. It's a not-for-profit group. They've taken over the old convent in the town of Dominion. Mr. Tom Donovan runs it. It's a great facility, and it serves a need, because when you look at StatsCan and their numbers and where it's at, it serves that need, Mr. Speaker, because it serves the idea of people who the only means of transportation is public transit for a lot of these people that doesn't run all that often, or cabs. And now, again, if you're asking somebody, for a family member to go to a bed in Dominion, and they live in Gardner and they took a cab, it's a few dollars. But a return trip, if they were to go to Waterford or Glace Bay, now we're talking about the $20s, $30s, $40. So these people are on fixed income, and we really shouldn't put that financial pressure on them. So, Mr. Speaker, I would have liked to have seen in Bill 177 a more clearer portion of where this is all going. Because when I talk about the healthcare aspect and the education aspect, it takes me back where I started on my road to discovery on Bill 177, and that is, what's this bill do for people in poverty? And we have many people in poverty, Mr. Speaker, and the oldest saying around poverty is that is relative. That we don't know, like people in certain groups don't feel that they're poor or that they're in poverty because they're a little bit better off than the one next door. Well, Mr. Speaker, We do see in the budget and mentioned in this bill about a lunch program and a breakfast program for children. And, Mr. Speaker, that's a good step forward. That says a lot about where we should be as a community. Because if you do not have children, that are well fed, the reality is they're not going to learn. And you know, the most despicable phrase I hear is child poverty. There's no such thing as child poverty. There's no such thing as a poor child. Children are born into poverty circumstances, but they're not they're child of poverty, not child poverty, Mr. Speaker. And that's what we have to worry about. We have to worry about when we spend our money on programs like breakfast programs, whether we spend it on through such things as a $150 type thing for sports and so on, that what we have to remember first and foremost is that there are young children in this province that are hungry. And if we lose sight of that, we're in real trouble, because they go to school that way, Mr. Speaker, and sadly enough, they come home and stay that way, Mr. Speaker. And there's that other side of poverty that we don't acknowledge, and that is the home caregiver, the mother more often than not, who herself ends up being in health distress a lot of times, because the nurturing nature is to give to the children and will not take themselves. So what we have is that cycle of poverty where there's not enough even for the children, and the parents have nothing at all. So we have to answer those questions, Mr. Speaker, until such time as we work forward to eradicating parents in poverty, that we're always going to have this problem, Mr. Speaker. And you know what? It's going to have more stresses on our healthcare system. It's going to have more stresses on our education system. And until governments recognize that real terms, that poverty is a driven issue, that poverty and getting rid of poverty is more important than giving tax breaks to large corporations, until we get a government that looks at really face-to-face, looks it in the mirror and says, this is what we got to do. We've got a mandate, and the mandate here is to help Nova Scotians, not a multinational corporation over in the Netherlands like ING. No, Mr. Speaker, what we need is a government that's responsible for the welfare of our most neediest people, our children, Mr. Speaker, who need to be clothed and fed, our seniors that need to be looked after. They're the ones that are not mentioned substantively in Bill 177 or in the budget, Mr. Speaker. So, Mr. Speaker, if we don't do those things, we're failing the majority of our citizens as a government and as a province, Mr. Speaker. They're the ones that put us here. They're the ones that will take us out, Mr. Speaker. So they're the ones that we got to be responsible for. Not a nameless corporation, Mr. Speaker, but the people that built this community, the veterans that we're celebrating this year, Mr. Speaker, the children that will come behind them, Mr. Speaker. So therefore, Mr. Speaker, this bill has to attain the respect of those group of people, not the international moneylenders, Mr. Speaker, and I thank you.
Thank you. Recognize the honourable member for Victoria Lakes.
Thank you, Mr. Speaker. Mr. Speaker, it's a pleasure to stand here this evening and address the honourable audience on Bill 177, the Financial Measures Act. It's important to me and especially to this government, Mr. Speaker. Voting against this bill could cause the government to fall, and that would be, it could be a good or a bad thing. Let me get deeper into my discussion here. And the most interesting part of the bill is the debt management fund and the commitment to insure $830 million from the offshore to this budget. Mr. Speaker, It's a general consensus that the $830 million can be put on whatever the government chooses to do. I'd like to clear that up, Mr. Speaker. It's already in law from Ottawa that to receive that money, it must go on the deficit. If that money doesn't come through because of the government falling in Ottawa, this government here will have to borrow $1.2 billion to be able to keep the budget so-called balanced the way that it was presented. Mr. Speaker, they talk about this budget being balanced and showing a $63 million surplus. That's very thin in the financial market that this government deals in. And Mr. Speaker, to me, it doesn't show a very good fiscal financial policy for this government. They talk about the reduction of the deficit, and Mr. Speaker, that's nothing more than a sham. It's going to take till 2009 for the budget to go back to the same levels as it is today. So where is the balance, Mr. Speaker? How can the government say it's putting $830 million on the debt and still grow the debt by $90 million this year? And I go back again to my honourable members, that Father Brooks Campbell, back in Xavier Junior College, told us in sociology class, you know, Gerald, he said that statistics don't lie, only the people that make them. And I say that not to be derogatory, but whatever figures you put into a computer would probably give you the results that you're looking for. So that's why I myself am a very untrustworthy person when it comes to somebody handing me figures. We should be, when I think about the figures and the debt, I truly believe we should be making royalties off our natural resources, and that's what I spoke on last night on the water bill, Mr. Speaker. We always seem to be giving things away and never getting money, never getting anything for them. The $90 million of debt and supposedly the offshore money that's going to the debt. As I said, there's no choice. That has to go on the debt, full stop. Nobody has a choice to do that. That's where it must go, and if it doesn't, it won't be received. But, Mr. Speaker, the debt keeps going on and on and on. The government, as I said this afternoon, is still borrowing $340 million this year. Well, Mr. Speaker, to me, that's total mismanagement. If you have a bill, most people owing money work out a plan on how to pay it off. We have a plan here that's looking forward to the bill. I'll just cite the Department of Transportation. Looking forward to the bill going from a deficit of $3.1 billion to 2011, it'll become $4.4 billion. So to me, there should be a plan in place to help lower that down and eventually eradicate the bill, Mr. Speaker. Mr. Speaker, let's look at what the Premier has said about the debt, and will Nova Scotians decide whether or not he told the truth. Every resident of this fine province today owes more than $12,000 each on the deficit. And with over $12 billion in debt, I'd like to know where the word balance comes into this. And Mr. Speaker, this province can no longer afford to grow the deficit. It sounds like a definitive yes that we were misled, Mr. Speaker. And to be sure, there are some people who suggest that the government should continue borrowing on the debt, while others say there's not. And Mr. Speaker, the Premier himself said he didn't believe that there was merit in the argument that we should keep on borrowing. He said such an approach may feel good one day, but then who pays for it tomorrow? And as I said, I think, Mr. Speaker, with that kind of a debt, tomorrow is here now. $2.5 million in interest, as was said during question period here today by the honourable member from Richmond. That is how much the interest is climbing. $2.5 million in interest daily. That's a staggering amount. And I referred earlier also that there was an old song that said we load 16 ton. Well, Mr. Speaker, there's no coal mines left in Cape Breton to load 16 ton. There's no steel plant left in Cape Breton to load 16 ton. So with the industries gone, the only line of that song that's relevant today is another day older and deeper in debt. And that's not a very good legacy to leave behind. So, Mr. Speaker, as I said, tomorrow has arrived, and it's time for us to stop adding to the debt. And it's funny, back in 1999, the Premier wouldn't support the budget and brought the government down because it added to the debt. Well, Mr. Speaker, since that time, the debt has grown by $2.5 billion. And to me, Mr. Speaker, that is underachievement. $2.5 billion is the entire health budget of this year, $1 billion more than in 1999, yet at that time he said that he could fix health care for a lot less and brought the government down. Mr. Speaker, I also said that there's no halo around this government nor around the Premier because, in good conscience, we should not be supporting more debt. In June 18th, 1999, the Conservative caucus voted against a budget to borrow $600 million. The Premier told Nova Scotians at that time, in good conscience, I cannot support more debt. And here we are, deeper in debt again, sir. The Premier does not have any credibility left because of the rising debt. And he has clearly misled Nova Scotians. And that's kind of harsh and hard to say, Mr. Speaker. But this bill does have some good things in it. For example, the $150 tax credit for the participation in recreation. But, Mr. Speaker, my evaluation of it is that that $150 will credit $15. It'll save $15 to the people who have their children already involved in sports. But how many parents are going to invest hundreds of dollars that they don't have to enter their children in sports to save the $15? The honourable member prior to spoke about the breakfast program. It is a good program, but, Mr. Speaker, it should be looked upon as a necessary stopgap measure, because when breakfast programs are growing, I feel that if the parents of the children had employment, then they wouldn't be required to have their children going to school hungry. And as we all agree, the children surely can't learn on an empty stomach, Mr. Speaker. I moved to the film tax credit. It was a good move, but it was eliminated when we had the film studio down in Cape Breton. The film studio has been closed and sold. I believe now it's a warehouse somewhere. And yet, now the film tax credit has been increased. But, Mr. Speaker, it doesn't do much for outside of Halifax. Mr. Speaker, roads, $3.4 billion, as I said before, to grow to $4.3 billion in 2011. Most people want us to pay down the debt, but, Mr. Speaker, it seems that there's an enjoyment watching the debt grow. I coined the phrase the other day, pro-regressive. I don't think there's such a word. I don't even understand the meaning of it. But proactive means you want to do something to help somebody or to resolve a problem. But when you look forward to the debt growing, you're being regressive, but you're looking forward to it. So I called it pro-regressive. I'm disappointed with that, Mr. Speaker, and I say that's mismanagement. The lack of accomplishments is underachievement. Mr. Speaker, to date we've lost 6 years of missed opportunity. I say that because there's no plan for 5 years where you want to be, 10 years where you definitely intend to be. That's a standard practice with any and all, even small communities that do an economic development plan. 6 years of neglecting the education system. Never mind that our students are the lowest funded in Canada. We have $500 million worth of deferred repairs in our school system. 6 years of increased fees and taxes. Just go back to the 500 user fees that went through in one day, in particular in the fall when the House was not sitting. 6 years of neglected roads. Mr. Speaker, I speak on that continually, the roads. Capital expected to grow, like I said, by 2011. Where's the fiscal management? Where's the plan? Where's to work toward eliminating that large capital deficit and allow the rural areas to catch up with the pavement and the planning that's required to help at least some rural economic development. And Mr. Speaker, when I talk about the lack of a plan, if there were a 5-year plan, and I'm looking now, every day there's numerous calls for tenders. There's numerous tenders being awarded. But this is May. Those tenders, to my estimation, Mr. Speaker, should be awarded in the fall. And the reason for that being, then the contractors know that when the roads open, they do have work to go to. What that does is it allows the contractor to project ahead to the coming year, that he has 2, 3, or 4 contracts. Yes, I will buy new equipment. Yes, I will hire some more workers. The workers themselves know that, yes, I'm going back to work as soon as the roads open. So what am I going to do? Yes, I'll allow myself to spend a little more on my family, or to buy a new vehicle, or to buy some furniture or whatnot for the household. It puts stability in the market. The workers know they're going back to work. The contractor knows they're going back to work. So it helps all the way around, Mr. Speaker. Mr. Speaker, let me go to the offshore industry. The Minister of Energy saying now that the budget is going to be increased by $1 million in the budget. And that's going to be to hire 4 new workers in the department. And I'm wondering what they're going to do, Mr. Speaker, because the oil companies have paid their $55 million in penalties and gone off. They've taken their ball and bat and gone home. Now we're going to put more money into that department and hire people to go looking for business. And they're saying, oh, now we're going to streamline the regulations. It's going to make it easier for people to develop. Mr. Speaker, I don't know if that's going to be 4 more patronage jobs, or whether it's going to be just some kind of smoke and mirrors for people to think that, yes, we have an offshore industry and we're developing it. When right now, Mr. Speaker, as I say, all we have is a project, one single project that's been there for years. And Mr. Speaker, I want to quote from the Cape Breton Post today, an article by Wes Stewart, and he quotes the Honourable Minister of Energy. Operators want a predictable and competitive business environment, one in which they can reasonably anticipate costs and approval times, Energy Minister Cecil Clark said Wednesday. That means lower upfront costs and quicker cycle times for explorers. Well, I guess our oil companies are becoming explorers, and the quicker cycle times, I'll leave that to the Minister to explain. Clark said a more flexible approach to licensing rules also could spur further exploration. Well, the flexible approach, Mr. Speaker, was long overdue before these companies became frustrated and packed up and left. Having said that, Mr. Speaker, as I said, the $55 million paid to the oil companies, I personally believe they have no intention of coming back, not those companies, because with the oil seminar that's going on in Houston, one of the officials from Encana stated recently, about 2 to 3 days ago, that they were frustrated with all these minute testing that had to be done at extremely high costs when dealing with Nova Scotia. Therefore, they pulled up and left. And that's why, Mr. Speaker, that they are gone from here today. Mr. Speaker, let's move to tourism in the budget. I look back and think of Cape Breton being called Nova Scotia's masterpiece. Mr. Speaker, if something is not done soon, it'll be a piece of pizza. That's about it. To come to life, well, I say we better get a life and invest in Nova Scotia's masterpiece called the Cabot Trail and the Bedore Lake Scenic Drive. Because, Mr. Speaker, those are international icons, especially the Cabot Trail, known internationally. They come to that trail, the whole province benefits. They'll come either through the Yarmouth ferry system, they'll fly into Halifax, but the whole province benefits by tourists traveling to the Cabot Trail. But Mr. Speaker, the problem is when I say the Cabot Trail and the Bador Lake Scenic Drive, the word trail is what's evident. I'd move to tuition fees, skyrocketing tuition fees, Mr. Speaker. I was told by a couple of students that their loan was cut off. One student in particular stated that he has one more course to finish his degree. But because he needs 6 more credits, 1 full course, and he can't take that in a summer course, it must be a full year in college. The problem is the Student Loan Board has decided that they would cut off his funding. So now what do we have? A catch-22 situation. We have a student that's that close, Mr. Speaker, 1 course away from getting his degree. Number 2, he can't get a good paying job because he doesn't have a degree. Number 3, how can he afford to pay a student loan when he can't get a job? So they funded him right up to the goal line, and then they put up a fence and the student can't score. So I don't understand the analogy behind that, Mr. Speaker. Let's talk about rural depopulation. Watching our small communities slowly die. Gas stations in rural areas that are a lot more than gas stations, but Mr. Speaker, they are an essential service in a rural area. But they're waiting and waiting and waiting for a decision of this government, and there's nothing in this budget to allow for the gas stations to hang on any longer, and so they're closing, Mr. Speaker. I'd like to cite Wayne and Carolyn Leal, residents and neighbors of mine. I can see their house from mine. They have a son and a daughter, both college graduates, the son teaching school here in Halifax, the daughter working here in Halifax. Look down the road a little further, Kathy and Stuart Squires, a son and a daughter, both college graduates, both working here in Halifax. Mr. Speaker, with that kind of analogy or that kind of thinking, the rurals, there's nothing there left for them. And the idea is there that I've been fighting since 1991 when I was first elected as a councillor. If you don't like the rural area, number 1, either don't complain, or number 2, move to Halifax. And Mr. Speaker, that's very evident today in this budget. So where's the investment in rural Nova Scotia? Neglected roads for years. I mean, we put on a neglected road of the week campaign. Capital deficit to grow by 2011, just in the transportation. Mr. Speaker, right now in Victoria County, we can't even dispose of our septic sludge unless to have our tanks pump unless we call an operator from outside our area. The Department of Environment closed the septic sewage disposal site that was available in Victoria, and it had outlived its life. It was over 30 years old. Well, that's fine. I agree with that. But give us an alternative. The company now is struggling and paying more to dispose of their septic than they are to collect it. And Mr. Speaker, I hope that will be remediated through the Department of Environment as I've been speaking with them. Mr. Speaker, there's 6 years of lost opportunity, and as I say, no planning to solve the present or reoccurring problems. Where's the vision? Where do you want to be in 5 years? Where do you definitely intend to be in 10? And given the time frame, Mr. Speaker, as we all know, time and years go by with the snap of a finger. And sooner or later, you'll be where you want to be. Rural infrastructure, and as I say, it's not water and sewer in the rural areas. Mr. Speaker, it's roads.
Order, please. Would the young member like to move adjournment debate, please?
By all means, Mr. Speaker, I'll move adjournment on debate.
Adjourn debate on Bill 177. Agreed? Agreed. Honourable Government House Leader in tomorrow's hours and order of business.
Mr. Speaker, I move the House to now rise to meet again tomorrow at the hour of 9 a.m. The order of business tomorrow will be a continuation of review of the estimates. And, Mr. Speaker, the House should be rising tomorrow at approximately 1 o'clock or shortly thereafter. Thank you, Mr. Speaker.
Motion is the House adjourned to 9 a.m. Is agreed? All those in favor say aye. Countermanded nay. The motion is carried. The House is adjourned to 9 a.m.